Hayi, hayo, and haya! My name is Emil Magpantay. I am a Deputy Lead Occupational Therapist working here at Royal Papworth Hospital. And welcome to Stroke Awareness and Tutorial. Okay, in 2019, the World Stroke Organization presented what's this thing called? A campaign, that's it. And it says that 1 out of 4 people will have a stroke. Don't be the one, yeah? Imagine that, 1 out of 4. That's a lot of people. That's 25%. Whoa, big, isn't it? Now let's talk more about some just basic information, some basic facts about stroke, yeah? Again, 1 out of 4 will have a stroke. That's a lot. Now, if you are going to separate that, they were saying that for 45-year-old, over 45-year-old, 1 out of 5 women will have a stroke. And 1 out of 4 men will have a stroke. So there's more chances that women will get a stroke than men, okay? And also, every 5 minutes, somebody gets a stroke. 5 minutes. You see that? 5 minutes. Okay, now, for those people that has a stroke, around half of them, 50%, will remain dependent on others for their day-to-day things. Yeah, about 25% will have difficulties walking, 25% will have problems speaking, about 33% will suffer depression. Yeah, of course, who's not going to be depressed? Half the body is paralyzed. You can't speak, you can't move, you can't walk, so you're going to suffer with depression. And the sad fact is that around 50% of the stroke survivors die within the first 2 years. And that mortality rate is far worse than when you are a survivor of cancer. Sad fact. Now, in terms of money, let's talk about banking. How much do you think it costs? Millions? Yeah, 4 billion. 4.8 billion pounds annually. That's how much it costs. That's a lot of money, isn't it? So it's really a serious stuff. So what is stroke? Or what is a cerebrovascular accident? Basically, it is a brain attack. Yeah? So, comparable to a heart attack, you have a heart attack because the blood does not get through the heart muscles. You get a brain attack because the brain did not get enough blood supply. So you can have short or a mini stroke where the symptoms of brain attack lasts only for 24 hours. This is called TIA, or transient ischemic attack. Yeah? Now, if the symptoms lasted more than 24 hours, now that is a proper stroke. So if you're in the ward and the person had an operation for more and they're presenting symptoms that are lasting for 2 days, then they're likely to have had a stroke. So if they are presenting with an arm weakness that lasted a day, beyond 1 day, arm sensation problem, it's likely they've had a stroke. Yeah? But if there is only a symptom that they could not find their words, or they started to become confused, that lasted for a few minutes or half a day, then that is a transient ischemic attack. Now, why are we keeping an eye on stroke? Why is it important at Papworth Hospital? Simple. Because it is a major side effect of surgery. Yeah? What do we do in Papworth? We do a lot of operations here, don't we? That's right. What are the 2 types or the different types of stroke? Okay, so blood does not get into the brain. How does that happen? There are 2 types, or there are 2 ways on how a blood would not come into the brain. The first one is because of a blockage. A blockage might be caused by a hardening of the arteries, atherosclerosis, which again, most of our patients have that. You can have blockage over a period of time. As one gets older, it's called a small vessel disease. So, like the small vessels on the latter part, the end part of the brain, it just gets old and it gets blockage. So you have a major part of the brain that doesn't get, the blood supply, and that's why you get dementia. You can have atrial fibrillation. Again, Papworth Hospital, atrial fibrillation, cardiology. Again, it's our area. Okay, so atrial fibrillation, where you go, and when that happens, obviously there could be something in there that could dislodge, and it'll go through the internal carotid artery, a jugular, and the internal carotid, boom, and then it'll block some, an area in the brain. Again, arterial dissection, when the artery just goes, and then you can have blockage in there. Now, after the surgery, how does it happen? Sometimes, they do an operation, and every now and again, accidents happen. Little things, little debris would get out of that. It's an embolization of an atheromatous debris, and it'll go, and it will block an aspect there. Okay, and also in the in the surgery as well, what they do is they minimize the blood flow throughout the system, so it doesn't become very bloody. So it's called hypoperfusion. When these hypoperfusion takes place and it becomes too much, sometimes hyperperfusion is so much that the blood does not get to the brain. So that's one aspect. Now, another type of stroke is one that is caused by bleeding or a hemorrhage. So you can have two types of bleeding. You can have intracerebral hemorrhage, where an artery bursted inside the brain, and there it is. So it's not supplying the cells, but it's just all over inside the head. So that's an intracerebral bleeding. Or you can have a subarachnoid hemorrhage as well, so which is just on the meninges or the covering of the brain. So you can have that as well. And when you have that, and obviously the blood is just outside the cells, and it does not supply the cells of the brain. And when that happens, you get a stroke too. Now we're going to talk about FAST. What is FAST? This is the government's initiative to inform everybody about the symptoms of stroke. So when you see FAST, you have to act fast. F stands for face. You know what happens? Face. All of a sudden just goes like that. So there's a facial droop. That's right. Or drooling, you start doing that. Okay. And then arm. What happens to the arm? You get arm weakness. All of a sudden, they just could not move the arm. Well, I can't do it. I can't move it. It's like, whoa, it's a wrist drop. They can't do that. They can't lift it up. So arm weakness. Now, sometimes the arm weakness or incoordination, that happens as well. So it's like, whoa, they're banging on things. It's like, scratch the head. It's like, whoa, what's happening there? That's arm weakness. Or they have incoordination with the arm, and this is because the feeling is impaired. They couldn't feel the arm. So they hold the cup, they drop it. What am I holding in here? Teddy bear. Oh my god, it fell down. That's it. So that's the arms. Speech. So what are speech problems? Slurry. I have a very bad impression, but that's do what I can with that. Slurry. So slurry, because you have drooling as well, that's called dysarthria. Dysarthria. Okay, say it with me. Dysarthria. Good. Another speech problem, which is not very evident, is the difficulty in finding the words. That is a speech problem. This is called nominal dysphasia. It's like, for example, what is this? I couldn't name that it's a pencil. And say, what's this? It's a USB stick, so I couldn't name. But if you present it to the person, point to the stick, point to the pencil, point to the USB stick, so they can name that, that's fine. So that's called a speech expressive. So they couldn't find the words, they sometimes just say random book or random combing hair and shoot the door, and the matrushka and stuck in Papworth bicycle. That is an expressive dysphasia. I am clear in saying things, but actually I couldn't get the right word, so it's coming out as jumbled. And you might think that they're actually confused, yeah? So it's actually, they know what they want to say, but it's coming out differently. So that's a speech problem. And when these things happen, the three things you've observed: facial droop, yeah? Arm, it's weak, it's dropping, uncoordinated. There's speech problem. T stands for time. Time. It's time for you to inform the nurse, yeah? If you're a healthcare assistant. If you're a nurse, it's time for you to call the alert nurses, yeah? Or if you're an alert nurse, it's time for you to call the doctor, okay? If you're in critical care, if you're a nurse, call the doctor, okay? Okay, call a name, okay? Time to call a name. N stands for nurse. A stands for alert team. ME stands for medical team, okay? So that's what you need to do. So other symptoms of stroke, okay, let's talk, fast is the very popular one. This time around, let's talk about the other symptoms of stroke. When somebody has a stroke, particularly that of the bleeding type, you get a disturbance in the level of alertness or consciousness. All of a sudden, the person would just be drowsy. Yeah, person would just be drowsy without the infection. Yeah, so that's a strange thing. When somebody becomes drowsy, I'm sure you'd know about this, and then you'd notify the right people. Okay, now thinking gets impaired. All of a sudden, the problem solving is impaired. All of a sudden, the person could just not recall things. They would have a denial of problems, and you think they're just denying, but actually, if they have a stroke, particularly on the right brain, the right brain just does not entertain problems at all. You have a weakness on the one side, and you say, "Is everything okay?" "Yeah, everything is fine. Nothing's wrong." Yeah. Because it's not that they're denying, it's just that the brain does not acknowledge problem at all. So it may present as a denial. A problem with thinking also presents itself like they don't know how to process things as well. So I've had in the past given them like a brush, for example, and they just don't know what to do with a brush. I gave them, like, for example, I've done in the past like a shaving foam. Here you go and shave yourself. So what they did is with the shaving foam, they just put it all over their head. It's like that. It's like, well, for me, I'm an occupational therapist and I respect individuality. I'd say, why not? It's cool. Maybe it's a hot weather. You're all right. But that becomes a problem once the person starts putting the shaving foam inside their mouth. It's like yeah, that's it. So I thought, okay, there is a problem there, yeah? Okay, now, somebody with stroke will present themselves having problems with visual impairment, okay? They can, not all of the time, but they may. Particularly not seeing the left side, okay? So it's half. It's a condition called homonymous hemianopia. Yeah, not seeing the left side. Okay, again, I did mention about the speaking problems. So you can have expressive problem, yeah, where they know what they want to say but they can't say it. You can have naming problems. You can have receptive problems, meaning you ask them to do something and they just don't get it because it doesn't register, but they know what they want to do. Yeah, so that becomes a problem. So sometimes, giving instructions is not the best thing to do. If they have expressive or receptive problems, there's no point talking and talking and talking. All you need to do to get them out is like, oh, I know, you want me to stand up. Oh, you want me to walk. Oh, you want me to walk. Okay, good. So that's fine. Okay, the other thing is slurring of speech, which I did mention. Because again, the muscle around the mouth is weak and you'd get drooling. Okay, so you would have problems with movement as well. Okay, particularly of the arms and the legs. And the movement can be because of a weakness. It can be because of a total paralysis. It can be because of an incoordination, or they're banging their hands, or they're dropping their cup. Yeah, okay. Now these movement problems is caused by the feeling, the sensation is impaired. They couldn't feel the hand. So no, with me, I know that I'm poking my nose, I'm picking my nose, I'm scratching my head, because without my eyes seeing it, because I can feel it. But with people with stroke and they can't feel it, it's like I'm scratching my nose. It's like, whoa, I'm combing my hair. Whoa, it's going there. Why is it going? I'm eating. Okay, so that's what's happening. Okay, so there you go. So that movement is impaired. Again, another symptom is an inattention to one side. This is interesting. Inattention is when they eat, they'll only eat half of it. Okay. Or when they shave, they just shave half of their body. Imagine. So that's interesting as well. Okay, so that's one. Now, obviously, one of the very obvious ones, if somebody's left side or right side is impaired, the movement is impaired, then how would you sit? Of course, you're slipped. You don't have a balance. So that's going to be impaired. How are you going to stand up? That's going to be impaired as well. How are you going to walk? That's going to be impaired as well. So those are the other symptoms. Again, if you observe those things, call a nurse, call alert nurse, or call a medical doctor. Now, how do we know that somebody has a stroke? How can you confirm? All these symptoms are just suspicions, They're just suspicions, okay? But how can you confirm that somebody has a stroke or a TIA? Simple. It's through a scan. And you only have two types of scan at the moment, yeah? You have a CT scan, which is the cheaper side, yeah? Although it's still expensive to do that. What a CT scan will do is that it'll tell you whether one is a bleed or a blockage, yeah? Because if it's a bleed, it's going to be very obvious that there's blood in the brain, Okay. So the other type of scan is an MRI scan. So that way you can, it's much more sophisticated, much more expensive. That's why it's being put at the last, So the CT scan is the first line, MRI scan is the second line, because what they want to do is to scan, like the perfusion, where is the blood flowing, or which part of the brain is still being supplied. Okay, and this can be done by MRI. So you can only confirm a stroke when you've done a scan. That's why it's important for us to scan stroke patients or people presenting with stroke symptoms. Okay? Next, we're going to talk about treatment. So what's going to happen? Okay, now what's the treatment for stroke? Okay, the first, and if there is a blockage, okay, there is this thing called thrombolysis. Yeah, thrombo is the blockage, lysis destruction of the blockage. So thrombolysis is a procedure where the blood or the vessels, the artery is injected or the vein is injected by a blood or a clot busting drug. And what it does is that it destroys whatever it is that's blocking the artery, and then you would have the blood will come back to the brain. The thing with thrombolysis is that it has to happen soon as they get to the door of A&E. It's like 55 minutes from door to needle. That is NHS target. 55 minutes. Soon as they come in, it's a stroke. It's not a bleed. It's presenting with symptoms. Blood thinner that would do that, and hopefully that destroys the blood. So that is treatment number 1, thrombolysis. Another exciting treatment is a treatment called thrombectomy, which means thrombus, which is the blockage, thrombectomy. You have to remove it. Yeah, it's the same procedure. You would have a catheter put in, yeah, either through the hand or and then all the way through the hair, and then thrombectomy, and then you'll go, suck it out and pull it out the same way as you would when you're doing some repair in the in our coronary arteries and things like interventional cardiology. So thrombectomy, that's another thing. These two are the very exciting, treatment for stroke. Thrombolysis and thrombectomy. Because the regular treatment is a pharmacological management. Management by giving you with pills. And what kind of drugs are you will be given to stroke patients? Antithrombotic therapy, lipid modifying therapy, antihypertensive therapy. So all of these medications are all medications that are actually given to people with heart conditions. So those are the treatment. Simple. Now what to do? Okay, what are you going to do? So if you're a nurse or if you're a healthcare assistant, question is, what are we going to do once we see these symptoms? Well, one very important thing, be familiar with the symptoms, yeah? Note the symptoms, observe the behavior, okay? Know the symptoms, observe the behavior, and note the time, yeah? Next, after knowing the symptoms, something's happening here, escalate. If you're a healthcare assistant, inform the staff nurse, yeah? If you're a nurse, inform the alert team, yeah? If you're in critical care, inform the doctor. If you're the alert team, inform the doctor, yeah? Okay, so those are the first two things. Know the symptoms, escalate by telling it to the person that can escalate it further. Pass it on. Okay. And then once it's been established, that it is a stroke, after either a thrombolysis or thrombectomy or nothing's been done, then the third step, if they're still in the ward, is just follow the rehabilitation advice that is suggested by the therapists, okay? Either through positioning, through moving and handling, which you always do anyway, so you're good at that, or through personal care methods as well. Swallowing is important because if they're nil by mouth, they're nil by mouth. If they're in pure diet, and you're good at these things, okay? Or rehabilitation advice regarding communication. So simple things: identify the symptoms, escalate what is observed through the appropriate channels, either through a nurse, through an alert nurse, or through the doctor, and then follow rehabilitation advice. So in summary, really, if you see stroke symptoms, call a name. Yeah, name. N stands for nurse. A stands for alert team. ME stands for medical team. Now, let's talk about Lorenzo. Okay, so where to document in Lorenzo? Okay, so if you need NIH stroke scale assessment, if you need the ABC2 TIA assessment or the Trussler stroke TIA pro forma, you go to cardiology, supplementary care, and then go to notes. Yeah, and you will find what you need. It's there in Lorenzo. So where are we now at Royal Papworth Hospital? Okay, we have a stroke improvement team that talks about these things. Okay, and it's comprised by assistant director of nursing. Again, we have consultant anesthesiologist and intensive care consultant cardiologist in there. We have consultant radiologist, consultant surgeon. We have critical care specialist, nurse, speech and language therapists are represented, occupational therapists, physio, dietetics, support and palliative care team are there as well. So we have a deputy chief pharmacist is a member of this as well, and we have again consultant liaison psychiatrist. So these are the people that have come up with this document, the DN467. Yeah. So if you have questions about stroke, okay, DN467 comes in, and that includes the procedure for what you need to do, and that includes how to use the I can't remember what it is now. It's the I'm losing my words. Call a nurse. Call alert. IPC sleeve, that's it, intermittent pressure garment, so that's a thing that you put around the legs, yeah, and it's white and it's connected to a pump, and all it does is like it squishes the legs, for stroke patients on the acute side, they need that, okay, IPC sleeves. So that is actually to prevent somebody developing a pulmonary embolism, yeah, because again blood clots can happen on the big muscles, particularly on the calf muscles or the gastrocnemius, and it could be dislodged, it can go to the lungs, and boom, it can be fatal. You don't want to do that. So again, it's DN467. Yes, cool. So that's it, guys. Thank you so much for listening. And if you want further information, so here they are. I'll do what I can. It's like, and you can do that, and you can look into these websites as well. And look into the DN467. That's really important. That's fine. And you'll see me around, not wearing this, wonderful shirt. But I'm wearing green. I'm an occupational therapist. Okay, thanks for paying attention. Thanks for listening. Hope I made it as entertaining as I can. And please don't share this to anybody because I think it's embarrassing. But if you think it is fun, subscribe. My name is Emil. I'm your occupational therapist. And thank you for attending this stroke awareness talk. Cheerio.